COPD, chronic obstructive pulmonary disease. It consists of mainly two diseases or pathologies: chronic bronchitis, emphysema, due to prolonged irritation and inflammation of the inner lining of the airways and the inner lining of the alveoli, that is air sacs in the lungs. So the symptoms produced by this pathology is mainly due to the tobacco smoking, that is the chemicals present in the smoke of the tobacco is injurious and damaging to the lung parenchyma. They produces inflammation in the airways, which produce obstruction in the passage of the air inside and outside of the lungs. And also the gas exchange process or mechanism performed by the alveoli, they are also reduced and also hardened. So due to which there is difficulty in respiration. The symptom produced in the patient of COPD is there is persistent cough with phlegm formation due to damage to the mucus secreting glands and the cells of the airway lining, which produce excessive mucus that blocks and produces obstruction and narrowing of the airways. Then there is tightness in the chest, breathlessness, dyspnea, cyanosis, wheezing, hoarse crepitations on auscultation, and there is edema, gain in weight, edema of the feet, legs, especially over the ankle joint, cyanosis. So these are the main symptoms present in the COPD patients. Due to this pathology, there is hypoxemia, that is, oxygen level in the blood is decreased and the level of the carbon dioxide in the blood is increased, that is hypercapnia. The mucus which is expelled by the process of coughing varies in coloration from white, yellow to green according to the severity of the disease. COPD is divided into 4 categories or grades according to the severity of the disease. Grade 1, when the force expiratory volume in 1 second is 80. Grade 2, when force expiratory volume in 1 second is 50. Third, when the FEV1 is 30. And critical, that is the fourth grade, is when it is below 30. So this is the grading of the disease. Mostly this disease of COPD is present in the upper part of the lungs. Now the diagnosis of the disease. Personal history, physical examination by the healthcare provider is evident in such patients from chronic lung diseases. Mostly X-ray series, CT scan, these are helpful for location, extent of the disease in the lungs. And then is the spirometry. This is a device by which we can estimate the functioning capacity of the lungs. That is the total lung capacity during inspiration and expiration. So speed and timing and the volume of the air that is going inside the lungs during inspiration and exit of the air during exhalation, which mainly consists of the carbon dioxide. So this is the procedure of the spirometry. Next, which is very simple and domestic one, every person can perform at home. That is the pulse oximeter. It is a small device. We insert your finger in the tiny device, and then there is calculation of the pulse rate or the heartbeat rate and the estimation of the arterial oxygen level. Mostly in COPD, when the oxygen level is below 90, then we need supplementation of the oxygen. So these are the various tests which are performed by the various devices, but the broad examination of anti-alpha-1 antitrypsin protein. This protein is produced in the liver, but in COPD patient, there is in certain cases, not all, in certain cases, there is genetic defect in the genes. So there is deficiency of this protein, that is alpha-1 antitrypsin protein is deficient, which cannot protect the damaging of the inner lining of the alveoli by these irritants which are present in the smoke, in the air pollution, the various foreign bodies that enter in the lungs, and they produce damage to the inner lining of the alveoli, which is vital for exchange of the gases. The function of this protein is to protect and bring safety and health to this tissue of the alveoli. So when there is deficiency of it, so it can be invaded by the various pathogens or the non-pathogenic irritants factors. So these are the various tests which are performed for the detection of the COPD and its severity.